Health Minister Yuli Edelstein told my co-anchor Manus Cranny that he plans to have 70 to 80% of the population vaccinated by May.
The response of the population is incredible. The efficiency of our medical teams is beyond any belief. And we are very happy with what's going on. We're just all the time reminding the public that we are trying to take the population at risk out of the equation. It still doesn't mean that the country has herd immunity or that we left coronavirus behind us.
The pace, we want to try and understand the pace. How sustainable is the pace of 150,000 doses per day?
We are keeping the pace for the last, I would say, 10 days. We started vaccination a little bit more than 2 weeks ago, but on the first couple of days, we were just vaccinating the medical teams in hospitals, in our HMOs. And then we started with 60 plus population. We added to that some chronic diseases. This is the population we are targeting right now. Operation of that kind definitely has some, let's say, some default in terms of in the end of the day, you can sometimes find some remnants of the vaccine where we call upon anyone who wants to get vaccinated to come and get the shot. But we are in general satisfied having 75 to 80% of those vaccinated as the population we targeted.
Will that slow down? Will that curve slope down over the next couple of weeks?
Well, I don't think so, because what will happen in about a week from now, we will start administering the second dose, the second shot of the vaccine to those who already had gotten the first one. So we will keep the same pace. What will happen, though, that our HMOs won't be giving appointments for the first shot.
Are you expecting any emergency supplies to make sure that your supply chain is full and robust? Any emergency supplies from any of the vaccine providers this month of January?
Unfortunately, at this stage, it doesn't look doable. Our next supply is supposed to come in the very beginning of February, which, as I've said, leads us to the situation where we will have to just give the second shot at this stage. If there will be pleasant surprises, we will be more than happy to use the new supplies. But right now, we are not starting with additional segments of the population.
There's a great debate raging in a number of countries about the correct interval between dose 1 and dose 2 on the Pfizer-BioNTech. What are you recommending? What's good for Israel?
We are keeping the recommendations of the company itself, of Pfizer. We are giving the second shot in 3 weeks from the first one. We know that it's not dangerous to be late a couple of days, but we are trying to, our HMOs are trying to immediately set an appointment 3 weeks later.
Are you actively encouraging? We're hearing stories that there's Facebook pages, people traveling around looking for those excess vaccines at the end of the day. Are you actively sending a message, Minister, to encourage people to turn up at the end of the day at centers to get excess Pfizer vaccine?
No, it's the other way around. We have people, sometimes who are trying to they're trying their luck. They just appear in the end of the day asking whether there is any possibility to get a shot, which shows that, as I've said, the response of the population is incredible, but we are very strict. We are instructing the HMOs to first and foremost deal with the population at risk.
In many ways, the world is looking at the rollout in Israel as a test case. How have you been able to ramp up your campaign so rapidly?
Well, first of all, I do have to say that we got prepared in advance. Let's never forget that we are just a small country. It was quite clear for us along the way that once any company will have a vaccine, the ready vaccine with all the approvals, FDA and all the other international approvals, pardon me being so blunt, but they won't even look in our direction. They will be looking for huge markets to sell the vaccine. So we signed our agreement several months ago when there was skeptic attitude towards the possibility to have a vaccine in the near future. And the next answer, or the real answer, would be our credible medical teams, the HMOs, that the moment we told them that the vaccine is available, in no time at all, they got prepared and they were out there.
What's the biggest logistical challenge in rolling this out?
The first one we encountered was the huge sets of about 1,000 doses. We were unable to go to distant areas with smaller development towns or kibbutzim, all the small places. We introduced the Israeli technology with the approval of Pfizer of how to split the sets. We now can bring as little as 50 doses to some distant points. And this is probably part of the answer. Why is it going so fast? Were we to start with the policy of just having huge stadiums, everyone who wants to get vaccinated could come there. For elderly people, for the population at risk right now, this is much less possible than to cross 300 meters away from your home and get vaccinated in your local clinics.
Are you rolling 24 hours at the moment? You mentioned stadiums. Are you open 24 hours?
No. We are open 7 days a week, but sometimes some places work till 10 p.m., 8 p.m. We are not working 24/7, though. I will tell you quite frankly, were I in the situation where I would have a couple of millions more vaccines, I would instruct the medical teams to work 24/7 right now.
Will you get AstraZeneca vaccine soon, and will that take you to 24 hours?
Well, in terms of the agreements that we have, we are not due to get AstraZeneca for the next couple of months. I was very glad to hear that they got the British approval. We are still waiting for the approval from the FDA. And we are counting on all the vaccines that we are expecting to get, because at this stage, let's be frank, we don't know whether it's once in a half year, in a year, once in your lifetime. This information is still not scientifically proven.
When you said that you signed deals early, you used the phrase "early bird," I think, in one of the articles that I read. Did you get a discount for signing early, or did you pay a premium?
No. First of all, the frank answer is I don't have a clue. I'm not very good in industrial espionage, so I don't know what other countries paid for the.
But I'm asking you what Israel paid. Did you do a deal? Did you get a beneficial deal for signing early?
No, we negotiated. We had tough negotiations. The result is we paid what we paid. But I think that what we always kept in mind, that as I've said already, we are a small market. So I didn't have any reasons to believe that asking for, say, 5 million doses, I can get the price of someone who asks for 500 million.
What's your piece of advice for the other health ministers around the world?
To never lose hope, to continue vaccinating, and we are all the time ready to share the best practices, to learn from the others. I don't think that we know all the truth about vaccination, so I'm talking to some of my colleagues and I'm getting some good advice. I'm trying to give advice when asked, and I think that we always have to remember that you can't be a green island in the red world. We want all the countries around us to be vaccinated as soon as possible.